In this episode, we're going to talk about GST on dental services. The provision of dental services to patients is generally GST free. At the simplest level, dental services are GST free where the treatment is provided by a recognised dental professional for the necessary and appropriate treatment that improves the health of the patient. It is important to look at each of the words in this definition to assess whether GST applies to the dental services in question. The ATO have a class ruling, CR 2013-14, that offers a full listing of all item numbers and procedures to identify which ones are GST free. There are only 3 or 4 items listed that are taxable, being the provision of mouthguards and written reports that are not addressed to a referring practitioner. All the other items are listed as GST free, but some of them require you to look at the notes in the appendix for any exceptions. Mouthguards are not GST free because they are not a treatment, as they are a preventative product. Other products that you might sell, such as an electric toothbrush, are not GST free because they do not treat a medical condition and are certainly not provided by a recognised dental professional unless, of course, you visit the patient at home and brush their teeth for them. Services which are predominantly for the improvement of the appearance of the patient, are also not necessary for the appropriate treatment of the patient and therefore are not GST free. This is what would normally be considered cosmetic dentistry. Veneers are a good example, which are subject to GST where they are attached merely to improve the look of the tooth, but would be GST free where they are restoring a chipped or broken or damaged tooth. It's difficult to understand why the removal of calculus, which is item 114, is GST free, but the removal of plaque, item 111, might be subject to GST. Tooth whitening, bleaching, item 118, is GST free provided you can show that it is a necessary procedure that treats a condition or improves the health of the patient. Where bleaching is done by the patient at home, which is item 119, it is most likely to be subject to GST, again because the procedure is not being performed by a recognised dental professional. So it's all those individual items in the definition that you need to look at. In summary, 99% of dental procedures are GST free, and it is only mouthguards, sale of products and dental procedures that are purely cosmetic that are subject to GST. Unless the dentist is strongly promoting cosmetic dentistry, then it is unlikely that the amount of GST charged will be high, or that they will receive a visit from the ATO.
Albert, your article in the ADAVB magazine on this topic brought a lot of attention. How can dentists identify which items are GST free for their accountant?
Oh, well, Alison, that's a great question because up until this point in time, most of the dentists have been effectively ignoring this item. And the GST is not automatically input into their software that they would be using, such as Dental for Windows or Exact or Oasis. So what they really need to do is review where their fees are coming from, and they can do that off their production reports and identify mouthguards and those type of items that are cosmetic that should have GST in there. And unfortunately, it will take a little bit of a manual calculation to then be provided to their accountant.
If most dental services are GST free, then why does GST apply to the 40% commission that dental contractors receive?
That question we get all of the time. And the reason for it is this: when you have a GST-free dental supply, it's between the patient and the surgery. The patient is actually paying the surgery. That is the transaction that's GST-free. When the dentist receives their payment for 40%, it's actually a payment between one ABN contractor and an ABN registered dental surgery. Therefore, that transaction is subject to GST, and that's the reason why the 40% commission has got GST on it.
How likely is it that a dental surgery would get audited by the ATO for not paying GST?
Oh, no, that's a great question also. I think in most cases it's fairly unlikely. However, the tax office is very sophisticated with its auditing techniques, and it would merely be a matter of, in the old days, looking through the yellow pages and saying which of these surgeries is actively promoting itself with cosmetic procedures. Because obviously cosmetic procedures are ones that are not for the care of the patient, for a treatment of a medical condition, and therefore they should be subject to GST. Also, when those business activity statements go in and we see zero in there for GST, absolutely none, that's probably another indication that that practice should have at least some GST, and they may get subject to a tax office audit. I hope you found this session informative and that it cleared up some of the queries that you may have had regarding GST. In the next episode that I do, I'm going to run through a very important issue that affects a lot of dentists, and that is corporate structures. So should you be a company or a trust, or should you just trade as a sole trader? I'll be running through how the different structures work and what the tax benefits are for you.